actually, I feel like when a lot of people hear I double majored, they're like, oh my gosh, she's so smart. But so it happened because when I was in high school, I did dual enrollment. And so I came in Florida State with a lot of credits already. So I had like maybe like 50 something credits. So it was a lot. And, having like almost finished half of my college career when I got to college, it was just a lot I didn't know if I wanted to do, right? So I didn't know if I wanted to go to med school. After I got into the courses, then I started taking like calculus and organic chemistry and physics, which I barely passed through the skin of my teeth. When I started taking those, I was like, if this is what med school is like, I don't know. And I wasn't 100% ready to be out there on my own. So I was just like, okay, I think that I want to go ahead and just double major because I don't want to graduate early because I think that I still have a lot to get out of college. And then, like I said, I just wasn't sure on what that next move should be for me because I think I switched my major like 5 times when I was at Florida State because I came in as biology pre-med and, I switched to, I think, psychology at one point. I switched to exercise science. Then I switched to family and child science. And then I think I realized I could just double major in both. And so like I did that and I really loved my family and child science courses. And I remember thinking in my head, like, I wish I could just merge like family and child science and like healthcare. And I feel like that was public health basically. It was a part of public health. And I didn't know that at the time because we didn't have like a public health undergrad degree there. So I didn't know like what that would look like. So just kind of through that, I was just like, okay, I'm going to go ahead and finish out undergrad. I ended up graduating in 2014 from undergrad, and I actually worked as a medical assistant right after. And I think a little bit before, probably, I worked as a medical assistant. And that was me trying to really still decide if I wanted to go to med school. So it was a small family practice, and I was literally right underneath the doctor as he was seeing patients. I was scribing. I was doing all the things and I loved it, but I still wasn't completely sold on the idea of I want to be a doctor. So just kind of kept doing that. And like I said earlier, like that's when I found the MPH program and I applied to it and I got in and I went there. But even like through that journey, like you had mentioned, like I think that a lot of people don't see the struggles because, we are talking always about the accomplishments and things like that because that's what people like to hear, right? So, but the struggles, they're there. And I feel like, I try to talk about them too because I remember taking a practice MCAT test at Florida State. So they had them set up where you could go in. They structured it like the whole setting was like the real test. I got in there, I took a practice MCAT, and when I thought about cheating on the practice MCAT, that's how I knew. I was just like, I was in there stressed. I was just like, let me look over my shoulder. I was like, yeah, Desiree, this might not be the right move just yet. So yeah, I mean, having like, that be a part of my journey and then struggling through like, those hard science courses that are meant to like weed you out, of course. That was a lot, but I think that it was all in helping me to find public health.
Love it, love it. A lot in there. I think the first thing I heard was like the dual enrollment, and I think you kind of highlighted the duality of it because while it's helpful in getting you into college and like really helping you to accelerate your path in college, it also on the other side of things doesn't give you the time to really develop maybe as a professional, as a student, to really understand all the things that you're able to do. And in doing that, you're like, okay, I could finish in 2 years, but let me really get the college experience. Let me really like find out what are the things that I want to do. And I think like that even goes into you wanting to work as a medical assistant and really just like ensuring, hey, okay, I think I want to become a physician. Let me get that experience and really figure that out, which I think is important.